Vaginal problems are some of the most common reasons women go to the doctor. They may have symptoms such as itching, burning, pain, abnormal bleeding, discharge. Often, the problem is vaginitis, an inflammation of the vagina. The main symptom is smelly vaginal discharge, but some women have no symptoms. Common causes are bacterial infections, trichomoniasis, and yeast infections. Some other causes of vaginal symptoms include sexually transmitted diseases, vaginal cancer, and vulvar cancer. Treatment of vaginal problems depends on the cause.
Endometrial stripe, which is represented by the white line. So if I was doing this as a real pelvic exam, I would scan to the right of the patient all the way through to the right adnexa, and then back over, all the way back through the uterus, over to the left adnexa. And the reason I'm doing this is because I don't see the pregnancy inside the uterus. So I'm suspecting that it's extrauterine or an ectopic pregnancy. I do have some hints though here using this phantom. In the posterior cul-de-sac region, I'm seeing a black anechoic area which would represent free fluid or blood. If I scan all the way over to the left adnexa in this case, the first structure that I come across, this echogenic area, represents the ovary. If I keep scanning to the left in the pelvis, I encounter this other area, and this represents, in this case, our ectopic pregnancy. When I'm medial, just right beside the uterus, I see the ovary, and I scan out a little bit more, and this represents the ectopic pregnancy. And this is what you should see, a round circular structure like this with a bright echogenic brim. And it is possible to sometimes see a fetal heartbeat inside the ectopic pregnancy as well. Now I'm going to change the orientation of the transducer so I'm in a coronal view. To do that, I'm going to turn the transducer counterclockwise. The uterus will appear circular because I'm cutting a cross-sectional view of it. And I tilt the handle of the transducer up to move inferiorly down into the region of the cervix, and then bring the transducer handle down to scan superiorly into the area of the fundus of the uterus. Again, in this case, I can see that there's no pregnancy inside the uterus itself. If I scan over to the left of the phantom, again we see the left ovary, and then right beside it we see our representation of the ectopic pregnancy, this bright circular area. Moving back towards the midline, the anechoic area just posterior to the uterus is represented as free fluid, or blood in this case.